Hello and welcome to the video. In today's video, we are going to briefly cover some topics about prostate cancer. Prostate cancer is one health condition that often goes undiagnosed until it's too late. It's important to get regularly screened for prostate cancer at least once a year or as recommended by your healthcare provider. This condition is exclusive to men. Men as a group see their healthcare providers far less than their female counterparts. It's important to understand this and get into the habit of seeing a healthcare provider regularly. Not seeing a provider as a standard practice is how some of us end up with poor health outcomes. If you never considered getting checked for prostate cancer, now might be a good time, especially if you are 40 years old or older. Please share this video with someone you feel may need this information and can benefit from it. Now, let's move on to the video. Before we can understand prostate cancer, we should know what cancer is from a general standpoint. There are many different kinds of cancer. In general, they all share similarities and common characteristics. Cancer is a group of diseases characterized by the uncontrolled growth and spread of abnormal cells in the body. If the growth and spread are not controlled, they can result in death. Some of the characteristics of cancer are uncontrolled cell growth, invasion, and metastasis. Uncontrolled cell growth is when cancer cells grow and divide without the usual regulatory mechanisms that control normal cell growth and death. Invasion is when cancer cells invade and destroy the surrounding healthy tissue. And metastasis is when cancer cells spread to other parts of the body through the blood and lymph systems. The presence of these characteristics are strong indications of cancerous cells. Now that we have a better idea of cancer as a disease, let's talk about prostate cancer. Prostate cancer is a type of cancer that develops in the prostate gland, which is a small walnut-shaped gland in men that produces seminal fluid. This fluid nourishes and transports sperm. Prostate cancer is one of the most common types of cancer in men. Some risk factors are age, race, family history, genetics, diet, and lifestyle. Age is important because your risk of developing prostate cancer increases with age, especially after 50. Prostate cancer is more common in African American men. If you have family members with prostate cancer, then you are at higher risk. Genetics are also a part of the equation. Certain inherited gene mutations, such as BRCA1 and BRCA2, can increase risk. Also, diets high in red meat and high-fat dairy products might increase risk. Since we covered what prostate cancer is, now it's time to discuss some symptoms and diagnosis. In the early stages, prostate cancer may not cause any symptoms. As the cancer advances, symptoms may include difficulty urinating, decreased force in the stream of urine, blood in the urine or semen, pain in the pelvic area, and erectile dysfunction. Prostate cancer is staged based on the extent of the disease, from stage 1, cancer confined to the prostate, to stage 4, cancer has spread to other parts of the body. Prostate cancer is diagnosed in several ways. Digital rectal exam, DRE, is when a doctor inserts a gloved finger into the rectum to check the prostate for abnormalities. Prostate-specific antigen, PSA. Test measures the level of PSA in the blood, which can be higher in men with prostate cancer. Lastly is biopsy. If initial tests suggest cancer, a sample of prostate tissue may be removed and examined. There are many treatment options for prostate cancer. The effectiveness of treatment depends on various factors. Some prostate cancer treatments may include, but not limited to, active surveillance, surgery, radiation therapy, hormone therapy, chemotherapy, targeted therapy, and immunotherapy. For low-risk cases, monitoring the cancer closely without immediate treatment is a part of active surveillance. Surgery might involve removing the prostate gland, prostatectomy. Radiation therapy is using high-energy rays to kill cancer cells. Hormone therapy involves reducing the level of male hormones to slow the growth of cancer. Chemotherapy is using drugs to kill cancer cells. Targeted therapy is when oncologists use methods that target specific weaknesses in cancer cells. Lastly, boosting the body's immune system to fight cancer is immunotherapy. As we draw to a close, it's important to remember a few things about prostate cancer. Prostate cancer is a type of cancer that affects the prostate gland. Prostate cancer mainly affects African American men. The risk of developing prostate cancer increases with age. Family history of prostate cancer, genetics, and diet and lifestyle, to name a few. Some symptoms of prostate cancer may include, but not limited to, difficulty urinating, blood in the urine or semen, pain in the pelvic area, and erectile dysfunction. Some treatment for prostate cancer are, but not limited to, surveillance, radiation therapy, hormone therapy, surgery, and immunotherapy. If you experience any of the previous symptoms of prostate cancer and are 50 years old or older, it's highly recommended you schedule an appointment with your healthcare provider. The sooner you get screened, the quicker you'll know whether or not you have this potentially fatal disease. Early detection is key for managing prostate cancer. That will conclude the video on prostate cancer. I sincerely hope you enjoyed this short video on prostate cancer. Please continue to support our channel. Make sure you like and subscribe to the channel. Feel free to share your thoughts and comments below. We hope to see you all in the next video. Until then, see you soon.